hormones?
Yes.
Okay.
Yes.
Yes.
Okay. So welcome to this class. I just wanted to introduce myself. This is my family. I'm married to Eric, and we've got 4 kids, 3 girls and a boy. And I started with Young Living when that littlest girl was about 8 months old. And so my boy is my only oily, all-natural pregnancy. But I started because I learned about all of the toxins that were hiding in everyday products that I was using on myself and on my girls, and just learned about some of the side effects that could happen due to hormone disruptors and all the things. And I just felt very convicted to protect their little female bodies to the best of my ability, and my own body and my husband and then our future children, just to do everything we could to support ourselves as naturally as possible. I'm very thankful for modern medicine. There is a time and a place for it, but if I can go natural before I have to do that, then that's my goal. And so I started with Young Living about 3 years ago, or 4 years ago. And just a little bit about Young Living is they've been around for over 27 years. They have the seed to seal guarantee, meaning they only pick the best seeds and they plant them, and they don't use anything. They are all natural, all organic, like beyond organic. Like they send sheep out to the field to weed the lavender. And then they harvest them, and then they distill them on site, and they test them, and they send them for third-party testing, and then they bottle them up, and that's what we get, our bottles that are pure. And essential oils are not regulated in the United States, meaning they only have to be 5% pure in order to be considered pure. And so you'll see essential oils on the shelves at the store or on Amazon, and you just have to be very careful to know where they come from. Young Living is very open about where their stuff comes from, and when you look at the labels, it should only say what it is. It should only say peppermint. It should only say lemon. It shouldn't say anything else. And then I went ahead of myself a little bit. Does anyone have experience with essential oils? You can like raise your hand, or if you want to say something, you're welcome to.
I do not.
Okay, Melissa does a little bit. Okay, so there is 3 ways to use essential oils. There is aromatically, like with a diffuser, or just inhaling them. You can also put like a drop on your hand and then cup it to make a scent tint. That's very effective if it's like oils for emotions. You can put them on topically. An easy way is like with a roller that have a roller top. Some oils are considered hot, so you'd want to dilute them with a fatty based oil like coconut oil or olive oil, or fractionated coconut oil, anything to help to like spread it out so it doesn't, you don't have the reaction on your skin. Or there's some oils that are very gentle that you can use them neat, meaning you can put them on your skin without any sort of carrier oil or anything. Lavender is a really common one that people use neat. And then there's internally. Taking oils internally is totally a personal preference. Some people are comfortable with it, some people are not. But Young Living has Vitality oils. So they have the white label, meaning that they've jumped through the hoops with the FDA to get them regarded as safe to consume. So you have like lemon Vitality, and then you have like regular lemon. What's inside the bottle is exactly the same. The only difference is the color of the label. You can use this internally, you can use this topically. They're different because of the FDA. Okay. So, hormones. So, when I say female hormones, what kinds of symptoms do you think of?
Hot flashes.
Flashes. Yeah. So we think of like hot flashes, we think of like being grouchy, anxiety, depression, weight gain, inflammation, kind of your emotions are all over the place. So our medical system puts us on medicines that will blanket the side effects, and they carry their own side effects. So they don't really accomplish the goal they're after. And so young people are being put on birth control. Women in transition are being put on synthetic hormones, and it affects men too. If you watch the news, or we've been watching Gunsmoke, you see all the commercials are about all of these medications, and they have all of these side effects. And so what happens when your hormones are out of balance is you have those weight gain, infertility, failing health, you're grouchy, and all of these are symptoms that your hormones are not right. And I'm actually looking at some notes. If I look down, it's because I'm trying to stay on task. Okay, so think of your symptoms as your body's way of screaming at you through your check engine light. So if you have a symptom, it's a sign that something is wrong. So for the most part, prescription drugs will turn off that alarm. They're acting like a Band-Aid. They're covering it up, and they're turning off the symptom and not really fixing the problem. And then you're on medication to cover up this symptom, to answer this symptom, to answer this symptom. And my whole goal was to solve the problem, not just put a Band-Aid on it. So our hormones control so much of our body. They control your reproductive system, your thyroid, your adrenals, your endocrine system. Your hormones affect your mood, your emotions, your metabolism, your energy levels, sexual function, stress levels, and the regulation of your cycle. So how do you know? Let's back up. I'm going too fast. So back to essential oils. For oils to work, you need to get them out of the box. You have to use them. You can't hide them in your cabinet. A lot of people will get their oils, put them in the cabinet, or stick them under their bed, and they're like, they don't work for me. Well, it's because you didn't use them. And it's not just like oh, I put lavender on my wrist and then it didn't help me sleep. Well, you have to use it. It needs to, get into your system and really work. There are supplements, nutritions, and oils. They're for health, to help you thrive. Most people don't know about nutrition. I'm not an expert, but even healthcare providers don't necessarily know about nutrition unless they're a nutritionist, and that's what they do. And a lot of people are skeptical of like essential oils because they don't understand them, and that's okay. It's weird. I get it. It can be weird, but it's weird that when I inhale an oil called Harmony, my brain calms down and I'm able to just like relax. That's weird, but it doesn't mean it doesn't work. So if you're skeptical, hold on to that. And I can point you towards books and articles and things to look into to help you kind of just make your own informed decisions. Don't take anything I say or anything Amy says or what you read as like biblical truth. Really dive in and do your own research. The thing that I think is so cool about these little bottles is these are plants, and God created plants. I don't know what you believe, but I'm a Christian, and I believe that God created plants, and I believe he created us to thrive. And so he gave us everything that we need to thrive. He made our bodies, he made our thyroid, he made our ovaries, he made our brain, and he loves us and he wants us to be well. And so we can use essential oils to help us reach those goals. Oils are homeostatic, meaning they help your body return to homeostasis, helping it work the way it was created to work. Okay, so back to this. According to an NIH study, a woman's menstrual health and hormones act as a gauge for overall vitality, how good you feel, and her overall health throughout life. So how do we know about the health of a woman? We can look at her menstrual health, her sex drive, and her fertility. We do not talk about fertility, or we don't talk about the menstrual cycle very much in our society. Sometimes we joke about it. We tell young girls that it's, it sucks to be a girl, and sometimes it's just going to be really hard, and, you just got to get through it. But it doesn't have to be like that. We don't have to be like that. If we understand the way things work and understand how our bodies work and live in that, then things don't have to suck. Okay, so there's 4 phases of the menstrual cycle, and I did not know this until very recently, and it's just kind of like changed the way I think about daily life. our 28-day cycles. Okay, so the first cycle is the menstruation. This is where you're bleeding. This is day 1 of your cycle. And if you think about your cycle in seasons, this would be the winter. How do we like to be in the winter? I want to wear cozy clothes and sit in a comfy chair with a book, and I don't want to talk to anybody, and I don't want to go out because it's gross outside. I just want to kind of sit and be. This is the week that your body needs to rest and rejuvenate. And if you can, it's great to honor the way God made us and cut yourself some slack. Don't schedule all these appointments that you have to do during this week, because you're not going to like it and it's going to be miserable. If your cycles are hard and they make you want to lose your will to live, your hormones are unbalanced. It doesn't have to be that bad. Periods don't have to suck. The second phase is the follicular phase. In this phase, you have a ton of energy. You usually have a renewed sex drive. This is like the spring of your cycle. So it's a couple days after your period ends, and you just feel really good about yourself. You feel thin. You want to start projects. You want to do extroverted things. This is like the planning phase. You have lots of good ideas and you just want to do the things. This is about a week after your period is over. And then you have the ovulation phase. This is 2 or 3 days. And this is the period of time when your hair is glowing, your skin is pretty, you're attracted to your husband and he's attracted to you. And it's just like all this really good things. This is the summer. This is when you feel good. Think about like summer and sunshine. You just want to be outside and soak it all up. You're just exuding joy. And then you have the luteal phase, and this is the fall of your cycle. So there's 2 parts to this phase. The first part is things are good. You still feel good about yourself and you're wanting to get organized. Maybe you're nesting a little bit. And then you have the later part of your luteal phase, and this is when quote unquote PMS sets in, hormones drop, and you just don't feel just super awesome. So I encourage you to start keeping track of this. And even if you don't have periods anymore, you still have these cycles. And if you start paying attention to how you feel, you can kind of figure out which phase you're in. And you can support yourself right where you are, so you don't want to kill people, because I understand that if you do. So why do we not know this in America? There is so much that interacts with our cycles. Let's talk about estrogen. I need to move this. Okay, so estrogen is the hormone that's responsible for the development and regulation of the female reproductive system. The actions of estrogen are mediated by estrogen receptors, and they are groups found in cells. So we are a society with too much estrogen, and I'll talk about bad estrogen in a moment. It's called xenoestrogens, but there's just too much of it all around. Xenoestrogens is the bad estrogen. It's found in our food, it's found in our shampoos, it's found in our cleaning products. It's often a chemical that's hiding in fragrance. So if you see fragrance on your label, then I would encourage you to switch to something without fragrance. Xenoestrogens are, they've made us as women infertile. We don't know our cycles. We have horrible PMS. We have bad menopause or perimenopause symptoms. We've lost our sex drive, and we've lost so much because of the estrogen in our environment, and it messes with men and boys too. So xenoestrogens are a type of endocrine disruptor that imitates estrogen. So when the xenoestrogens enter the body, they block the estrogen receptor sites. So if you have an estrogen receptor site and the xenoestrogen comes in, it blocks it. So then no good estrogen or progesterone can get there. So what bad problems come from estrogen or xenoestrogens is, and these statistics are kind of just like made my mind crazy. So 40 million women in the US suffer from PCOS, which is fibroids, endometriosis, painful periods, acne, obesity, and thyroid issues. 1 in 10 people have endometriosis, good grief. 13 million women in America have thyroid dysfunction, and we're not just talking about like reproductive hormones. 1 in 8 couples is infertile, which has really increased in the last few decades. 30% of women have fibrocystic breast disease, which leads to an increased incidence of breast cancer. 7 million women have clinical depression, with the most of that being related to hormone dysfunction. And every 10 minutes, there are 12 hysterectomies performed. So our world's answer to hormone problems is to shut them down or take them out. And which is really sad when you think about it, because that's, I mean, if it has to happen, it has to happen. But that's not how it was the intention of creation. So again, what are the 3 areas that determine a woman's overall health? Is menstrual cycle, sex drive, and fertility. So keep thinking about how those might apply to you as we go on. We tend to think that hormones are just a bad luck of being a woman. We can't trust them. They're a terrible thing to endure. And actually, in ancient times, ladies used to go to the red tent and hang out with each other during their period as a way of honoring how their body was working. And now we do all the things all the time. We don't take a break and let our body just rest. And sometimes we can't. Like if you have a job, you can't just not go to work for a week. But there are things you could do to support your body. So we talked about xenoestrogens, which is the bad estrogens. Go home and actually Google that. Write that word down and go Google it and do some reading. It's quite interesting. And my thoughts are know better, do better. So when you know that something is bad, you can make the better choices. And then you'll start switching things out. That was what we did. We started switching things out with Young Living products. And I love it because none of Young Living products have xenoestrogens in them. When the xenoestrogens are a part of the equation, you have estrogen dominance, and your body doesn't care as much about the level of your estrogen and progesterone, but more about the balance. So think about like sisters playing in a field. You've got estrogen and progesterone, and then the wicked witch of xenoestrogens comes in and just totally disrupts everything, and it causes your body to become estrogen dominant. And so it doesn't matter if your progesterone levels are testing as normal, you're still estrogen dominant and your balance is still disrupted because your receptor sites are blocked with xenoestrogen. So they're still blocked, and nothing, if they're blocked with the bad stuff, none of the good stuff can get in there. Okay, so progesterone. So progesterone is produced after ovulation during the second half of your menstrual cycle. Usually you think about progesterone when you're trying to sustain a pregnancy. That's always been the way I first learned about progesterone, was trying to sustain pregnancies. But during a cycle, if a pregnancy does not occur, then the levels of progesterone start lowering, which is what signals your body to start the next month of the menstruation cycle. And as women age, our progesterone levels drop, and staying hormonally balanced becomes challenging, causing everything from sleep to mood disorders to other health concerns. So where am I? Okay. So I'm so sorry. So one of the things progesterone helps our body do is sleep. And you can tell if a woman has enough progesterone because she sleeps like a baby. Progesterone can bind how it's supposed to, and she gets rest. So when a xenoestrogen is there, a progesterone can't get into the cell like it's supposed to. You lay awake all night, you have the hot flashes, you don't want your husband to touch you, and your hormones just aren't functioning the way they're supposed to. And if your hormones are screwed up, sometimes you just want to kill people, and then you go to the doctor and they say everything's fine, and then they're measuring your progesterone and they say it's within normal ranges, but then what does that even mean? So yeah, it's just a vicious cycle. So enter essential oils. Young Living has all natural products that are infused with essential oils that help you maintain balanced hormones and support your wellness. So what does that look like? That's like putting lemon in your water. It's like putting frankincense on your face. It's putting stuff into your diffuser. It's switching out your household products, switching out your cleaning products and your laundry products, switching out your shampoos and your makeups and your perfumes, getting all of the gross toxic chemicals out, the things that have the xenoestrogens away from you, so that you can release those receptor sites and the the progesterone can get in and do what it's supposed to do. So a big answer for a lot of people is Progestence Plus. So when progesterone is normal and it's where it's supposed to be, then your uterus lining is thick and stable. It initiates menstruation. A lot of women who have progesterone problems don't have regular periods, like they go months without bleeding. So if that is your story, then progesterone will help signal that to start back up. It's important for blood sugar balance. It helps burn fat. If your progesterone is out of balance, it's really hard to lose weight. It supports a normal sex drive. It can drastically reduce hot flashes and night sweats. It normalizes blood clotting. So if you have really painful periods, it's because you don't have huge clots. You don't have enough progesterone. It helps support a normal thyroid function, decreases vascular inflammation, which is blood pressure. So high blood pressure can be a symptom of low progesterone. It decreases overall body inflammation. It supports breastfeeding if you're nursing. It supports normal fertility. It's been progesterone, not synthetic progesterone, but actual progesterone has been shown in studies to reduce breast cancer by 500%, which is crazy. Alternatively, synthetic progesterone called progestin has, I don't know the specific number, but I believe what I read was 20 times more likely to cause breast cancer. And honestly, that is terrifying because before I knew all of this, 3 of my pregnancies, I took synthetic progesterone to sustain the pregnancy. And it was just I didn't know the risk, but it was just something you did to, keep your pregnancy because you don't want to lose that. So then I'm hoping that by using progesterone, that flips that around. It can make breasts light and fluffy. Dense fibrotic breasts that are from too much estrogen can lead to breast cancer. Drastically improves sleep, helps with joint pain and TMG, and it can improve your skin. So how do you know when you have enough progesterone? You get your sex drive back and you sleep like a baby. A lot of people will use Progestence Plus. On the bottle, it says to use it on your inner arms or thighs. Some people will use it under their tongue, like blood pressure patients. They'll take their medication under their tongue because under your tongue has a very large blood vessel. And so it helps it get into your bloodstream and get where it needs to go faster. When you start using Progestence Plus, it can just change your life. And you'll know when you're getting enough if you look at your sex drive and how you're sleeping. So if those aren't good, use a little bit more, and then in a week, ask yourself, how are those doing? Trying to check the chat occasionally. Yeah, your belly button could be good too. Okay. If you are over 30 or 35, your progesterone is probably not what it should be. And if you don't have these parts, like you've had a hysterectomy, it will still support your body. I listened to a lecture by Dr. Edie Wadsworth. She's a medical doctor and a Young Living Crown Diamond. And she said she couldn't think of a time when she wouldn't use Progestence Plus. So some people wouldn't use it if they had progesterone receptor positive breast cancers, but that in itself is caused by synthetic progesterone. So that's just something to keep in mind. And okay, switching gears a little, a huge number of women in America are on antidepressants. A bunch of these women are not depressed, and they get put on an antidepressant because their hormones are out of whack. So again, this is how our medical system deals with hormones. Shut them down, take them out, or put on an antidepressant, which is going to shut down your progesterone. You can't sleep, you lose your sex drive, but you just don't care about it. So an action plan here would be start hormone oils, eat better. Nutrition is a great way to take care of your body. And if you are going to change your meds, go slow and talk to your doctor. I'm not a doctor, but I encourage you to be your own advocate. Do some research, figure out the questions to ask, and just do your own research. There are a group of people that do need the meds, so don't hear what I'm not saying. If you need the meds, that's okay. but not everyone does. When your estrogen and progesterone are in balance again, odds are you'll feel like yourself. And again, how do you know if you're getting enough progesterone? Look at how you're sleeping and your sex drive. So, natural estrogens. Women that are perimenopausal or post-hysterectomy need more estrogen and progesterone. There are 3 products, 2 here that I'm going to talk about, that help with the estrogen and progesterone. This Lady Sclerol is an essential oil. People love to put it on their lower abdomen every morning. It smells amazing, but if you don't like it, you just put it down in your lower stomach and don't smell it. And then PD8020, that's a supplement. It's got DHEA and pregnenolone, which are just fancy words for precursors to all your hormones. Women who are perimenopausal, so they're in transition, or post-hysterectomy, you need these because your body is slowing down on producing hormones. And so these contain the building blocks to help you get to where you want to be. Benefits of pregnenolone, which is in the PD8020. It's the hormone for progesterone. It's neuroprotective, so it protects your brain and cells. It enhances your memory, and it helps with pain of arthritis. And then benefits of DHEA, which is also in the PD8020. It improves bone density and muscle mass, protects against depression, cognitive decline, and mood swings. And it's the precursor hormone for estrogen function. And fun fact about PD8020 is it's actually very effective at helping with migraines. So, moral of the story, start with progesterone and it might fix your problems. Okay, ways to improve your hormones naturally. There are things you can do without, anything. And then there are some oils and supplements you could think about. So you want to look at healthy fats because hormones are made from cholesterol. So if your hormones are unbalanced, and even if they're not unbalanced, a low-fat diet is actually not good for you. You need those healthy fats. Avocados, chia seeds. Be careful with like cheap cooking oils because those are not good for your hormones or your brain. And you want things like olive oil, coconut oil, the good oils. Decrease sugar. Sugar is not good for you. Sugar can cause inflammation. It can cause estrogen levels to spike. It causes glycogen, increases cortisol, which is the stress hormone, makes you crave more sugar. And anyone with PCOS, it means you have an insulin resistance, so you need to cut out sugars anyway. Increase your fish oil. A lot of people will say they don't want to do fish oil because they burp it up. If you're burping up your fish oil, then it's not a good quality fish oil. And Living has one called Omega Dries, and it's a very good fish oil. Good fish oil shouldn't come back up. B vitamins are very important for your hormones. And I learned recently that you should think about if you're consuming a lot of enriched flours, like with breads and crackers, if they have enriched flour that contains synthetic B vitamins. And what are B vitamins? They're your brain, the emotions, and food. So if you're consuming synthetic B vitamins, then it's wrecking everything else, and the good B vitamins can't get to where they want to go and do what they're supposed to do. Think about your thyroid health. So many people in America need thyroid support. Fluoride cooks your thyroid. Where is fluoride? A lot of times it's found in our toothpaste. It's found in our water. So if you can replace your toothpaste, and if you can get a water purifier, then great. I can't afford one right now, but that is a goal. Chlorine in your drinking water displaces iodine in your thyroid. Endoflex is an oil from Young Living. I only have the Vitality one right now, but I put a roller top on it. But it supports your thyroid. You can put it directly on your thyroid, or you can put it in a capsule. If your thyroid is working well, then everything in your body works well. Endoflex supports the entire endocrine system, which is your adrenals, your thyroid, your kidneys, etc. Endoflex, if you've got young children, is a tantrum tamer. And I'm actually conducting an experiment right now with my 4-year-old and my 2-year-old. And she's not 4, she just turned 5. Wow. They have big emotions. And so I've been putting Endoflex right here on them every day, and it's actually making a big difference. I just saw your question, or DHA in most prenatal vitamins. Yes, just make sure that it's not fake, because that's the thing too. Okay, sleep. We need deep, restful sleep consistently. I don't know about you, but I am guilty of not doing that. But we way undervalue sleep for the most part. As women, we don't sleep enough. So we have great oils to support sleep. A lot of times we're not sleeping because we don't have enough progesterone. So a good way is to start with Progessence Plus every night and just put a little bit on your forearms or wherever you're going to put it. But sleep is when your body repairs itself. It's when you make your hormones. And then Ningxia Red, which I forgot to bring down a packet or a bottle, but Ningxia Red is a superfood drink. It's got more antioxidants than any other supplement. It's good for everything. It supports all your body systems. It's good for men, women, kids. It helps your mood. It helps with energy. It helps your immune system, and it won't spike your insulin levels. It's a puree, so there's lots of protein in it too, and no sugar. Okay, so other products to think about is there is an oil called Dragon Time that Gary Young, who created Young Living, actually formulated for his wife to use for that time of the month. I have it in a roller. My friend had Dragon Time and she gave me some. But it's use it the week of your period. It has blue yarrow, which supports hormone levels when they're going up and down. It's mild enough for teenagers if you have teenagers in your life. You can roll it on your ankles, wrists, put it in Epsom salt in a bath, or roll it on your abdomen. There are so many options for supporting hormones, heavy, painful periods. They don't have to suck. A lot of young girls are prescribed birth control pills to help control their periods. And then fast forward 10 years and they wonder why they're struggling with fertility. There is a correlation there, and it's sad. So I roll this, like if I'm having cramping, whatever, I roll it on my stomach every 10, 15, 20 minutes until it goes away. Then there is Sclerescence, which I don't have any to show you, but it's designed to support the reproductive system. You can put it on your ears, your wrists, your ankles. This isn't a scientific fact. There's been no studies, but there have been people who have said that it's more effective when applied by their male partner or their husband. Don't really know why. Maybe it has to do with the frequency. Again, there's no science to back that up. It's just what people have noticed. And this list isn't complete. There are so many options for supporting your hormones. Okay, so there are ways to support your hormones without shutting them down. Eat good food, eat less sugar, get good sleep, and utilize quality oils and supplements. So you might be thinking, like, that's a lot of information. How do I make this change? Well, the first step is just deciding. Get yourself a Young Living membership. It is not a contract. There is no saying you have to order this much every month or you have to do all these things to be a member. You can literally get your membership and get what you want when you want it. I recommend a subscription because if you're going to be using the things, then you might as well be getting points back. You might as well be getting a discount. But you don't have to feel overwhelmed. You don't have to try to remember everything. Sorry. We can create you a wellness plan. I would encourage you to, if whatever you're doing, whatever you try, to give it 6 months. It takes 180 days to see if something is working. And I actually have this book that I'd be willing to talk with you more one-on-one about, but there are protocols in here for hormones. So there's adrenal support, there's thyroid support, there's stuff for men if the man is having trouble with hormones. Sorry, I lost my place. I don't even know where it is. There it is. There's men, women, menopause, postmenopause, adrenals, fertility, thyroid, so much information tells you exactly what to do and how to do it. And then when you get your oils and your supplements, you need to use them. Like I said, use them for 180 days before you decide this isn't working, or honestly, it will work. And then if you forget what to do, you just ask. That is what Amy's here for. That's what I'm here for. If you don't know what to do, you just ask. So I'm going to, this Zoom thing is going to kick us out in 1 minute and 55 seconds. So I want to thank you for coming. And if you have questions,